Good morning. I'm Dr. Duke Majan, CEO and founder of Duke Spine Institute. Our patient travels here from Florida, from far away in Florida. She has neck pain, 2 discs that are damaged, causing her neck pain. Anywhere else, she'd be offered a fusion for her neck pain and her disc problem. But here we have another option, and that is the laser surgery called the Duke Laser Disc Repair. We've been performing this surgery for 19 years, almost 20 years now. And this surgery is minimally invasive. It's done virtually no bleeding. We've never had a complication in 19 years of doing the surgery. No surgical complication. We had one anesthesia complication, but no surgical complications. And our patients have on average 99.6% of their neck pain gone. Neck pain that comes from a disc. There's other causes of neck pain. Our next patient has the other cause of neck pain, which is facet joint pain. This patient has disc pain, so we're going to go in and fix her disc. She has 2 discs that need to be repaired, and that is number 5, 6, and 6, 7. So the first thing I'm doing is I'm feeling for her spine. Shot. This is a technique I was taught by the Korean doctor, Dr. Sang-Ho Lee, the one who invented the treatment. 2, 3, 4, 5, 6, 7. I'm going to go north just a little bit. Dr. Sang-Ho Lee was the founder. He's a neurosurgeon in Korea, founder of the Woodidal Hospital. And he was the first to do endoscopic cervical spine surgery. Dr. Sang-Ho Lee taught me this technique. He and Dr. Gun Choi. This was 20 years ago. Shot. All right, I'm going to start with 6, 7. Let's see. Shot. So I'm right over 5. Everyone agrees. 2, 3, 4. Sorry, I'm over 6. I apologize. I'm over 6, so I'm going to go up 1 disc and down 1 disc. Yes, thank you, Jordan. Let's count. 2, 3, 4, 5, 6, 7. So I'm doing the disc above and the disc below where I'm at. I'm going to start with the disc below. Shot. So I'm just going to slide down a little bit. Shot. Shot. All right, perfect. I'm going to go in. Let's get a shot and an AP. Quick AP. Quick. Right there. Perfect. We're right in the middle. Go back to a lateral. Any questions you have during this surgery, feel free to ask. I like teaching, Sean, and we have a lot to teach the public. You will not see this surgery done anywhere else on a live stream. We live stream all of our surgeries because we believe in transparency. Transparency is something you don't see anymore these days with all the AI and doctoring of things, but here at Duke Spine Institute, you see everything we do, you hear everything I say, and you get to see how the patients do in our testimonials. 2, 3, 4, 5, 6, 7. Everyone agree? I'm going to do a discogram right now. Show us the disc at 6, 7. Show us the needle in the disc. Yes. I'm going to inject some dye. You're going to see it leak out the back where the herniation is. Shot. There it is. So it just leaked out. Show us the tear. Shot. Shot. Up. Shot. All right. There's the tear. You guys see the black line? That's how the dye is leaking out of the disc to the back. There should be no tear. There should be no leakage of dye in a normal disc. But her discs are not normal. If they were normal, we wouldn't be operating on them. This disc is causing her pain and her symptoms in her left side, down her shoulder, arm. We're going to go in and perform our Duke Laser Disc Repair. Again, we've done over 2,650 of these laser surgeries in 19 years with 0 surgical complications. 0. We've had 0 infections, 0 carotid injury, jugular vein injury, esophageal injury, trachea injury, spinal cord injury, nerve injury, spinal fluid leak, blood clot in the lungs, blood clot in the legs. I mean, keeps going, the list. Heart attack, stroke, none. That makes this the safest spine surgery in the world for a disc problem. And since it's also the most effective spine surgery in the world, and the fastest recovery. You can still see the tear there. Jordan, show us the tear. Look at that tear in the wall right there. You guys see it? It's like a crooked tear.
Yes, we do.
Any questions?
At this moment, no current questions.
So the audience knows everything.
I believe so.
Sounds like, how many people we got?
As of now, 10.
10 people. Sounds like we need another viral video.
I believe so.
Only
yeah.
10 people watching this miraculous surgery. And, you know, we need to do something really negative, something that these social media piranhas thrive off of. We got to find something to do negative. All right, who wants me to yell at them today? Raise your hand. Luis. All right. So I'm going to cuss Luis out so that we can get some more views and people can learn more about how we're saving lives through this amazing surgery that needs to get out there so people know about it. By the way, look at the blood loss. We've had 2 drops of blood. That's all we're going to have. This surgery, the blood loss is generally about 1 milliliter, which is 20 drops. All right, we're right in the middle. It's perfect. Oh, now look at that x-ray there. That's a beautiful x-ray. You can actually see the dye has leaked out on the left side, and it's around the nerve root. Show us the nerve root. That's the nerve root, folks. That right there. So the dye is wrapping around the nerve root. There's another nerve root below, and it's, yeah, same thing. All right, you can almost see the brachial plexus. So pretty cool. Again, we've had 3 drops of blood. I'm going to advance the dilator in now that I know it's in the center shot. Any questions?
At this moment, no current questions.
All right. What if I call the audience a bunch of baboons? Do you think we'll go viral for that?
That's a good question. But we did just get a comment coming from Scott on YouTube saying,
Scott.
saying amazing, you're working. Just thank you for everything you do.
Thank you, Scott. Thank you so much. It just saddens me that, you know, to be able, for people to be able to see what we do, it's not good enough to save lives. It's just not good enough anymore. You've got to just do something negative to be able to get the message out, unfortunately. So we tried it, and not really for our liking. So we'll leave it at 1 negative viral video. Everyone agree? All right. Now, it's pretty cool. You can see the dye in the back of the spinal cord, too. Jordan, show us the dye in the back of the spinal cord. Nope, that's the front. There's the back. You can see the dye layering out right behind her spinal cord. So, pretty cool stuff. Now, the Koreans who developed the endoscopic technique in the neck, Dr. Sang-Ho Lee, Gun Choi, these guys, pretty much, from what I heard, they don't do a lot of endoscopic surgery anymore. Why? They had some serious complications themselves, but they also do the surgery differently than I do it. I always put my patient to sleep, and that way the patient's not moving around, they can't get hurt. So the only way they can get hurt is if I hurt them or the anesthesiologist hurts them. And I'm not going to hurt my patients. I'm very careful. I'm a good surgeon. So with the patient completely out with general anesthesia and chemically, what we call chemically paralyzed, the chance of them moving and causing an injury is extremely low. And that's what we want. We don't want them moving. The Koreans used to do these surgeries. When I learned them from them, patients were awake, they were under propofol sedation, and they were thrashing around during the surgery, okay? So it's no wonder they had some complications. I don't know why they didn't just use general anesthesia. It's a no-brainer in my opinion. Put the patient to sleep, don't let them move, do the surgery. You're right on top of the spinal cord. You don't want the patient moving around. Then, of course, they didn't do the laser either. I brought the laser in and did the annular debridement. We published that for the first time, probably about 15, 16 years ago at a national meeting. And then I peer review published it in the Surgical Neurology, Journal of Surgical Neurology about 13 years ago. The Duke laser disc repair surgery. At that time, we had about 62 patients and we had no complications. Our success rate at eliminating neck pain was around 94%, somewhere around 90, 92%. Headaches, 92%. Are we okay? Is that a snap? Hold on. A little bit overexposed. Seems to be working good. Are you cleaning that interface? Is there an interface there? Is it glass?
There's a glass that we don't clean. We don't touch it.
You don't want to.
Yeah.
You don't want to use a little alcohol and just
No.
isopropyl alcohol.
No, we
Pure.
replace the glass.
Got it.
Yeah.
But you don't think if there's some dirt somehow on the glass that it could cause some issue? You see what I'm saying?
Yeah. I see what you're saying.
So almost like just use a alcohol wipe and wipe it down. All right, folks, what we're seeing here at the bottom of this tube is the tear in the annulus, the annular tear. This is what we fix with our laser surgery. It's the annular tear that allows the disc material, the nucleus pulposus, to herniate out. Henry,
Yes, sir.
since we're talking about neck pain, let's show the audience the 30 different causes of neck pain.
Of course.
I don't know. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. Before we talk about the animation you just watched, take a look at the laser fiber. It's got a glass core. This is an optical fiber. It's only 0.5 millimeters, so it's half a millimeter. You guys can see a millimeter there.
Yes,
right?
we can.
It's half a millimeter. And this goes through the endoscopic port of the cervical scope. Everything we use is FDA approved. We do not use anything that's not FDA approved. All of our equipment is FDA approved. Can I get a ray? All right, here we go. We just changed out the fiber. I didn't feel like it was performing enough. And this is definitely better.
Better?
Yeah, I think so. Yeah. Yeah, this is better.
Okay.
I think that other one should be sent back, if that's possible. Right? Oh, look at the herniation right there, guys. Guys, look at this herniation coming up. This is about a 5 millimeter herniation. It won't come up right now. It's stuck in the tube. It's too big. I'm going to reach in, get the light on here. Henry, look at this. I'm going to grab it out with our grabber.
Copy that.
Now the grabber, called the pituitary rongeur, look at that. There's the herniation. Bring the ruler. You guys see it?
Yes, we do.
The grabber is what the Koreans used to use. This is about 5 millimeters, exactly as I told you. It's a 5 millimeter piece of herniation. You all see that?
Yes, we do.
Okay. So, the Koreans just use the grabber. All right, there's only a few surgeons in the world that do this type of surgery, endoscopic transdiscal surgery. And probably 3 in the world that know how to do this surgery. And for those of us that do the surgery, 2 of us use just the grabbers. Only 1 of us uses the laser. Okay? Now, other doctors may be using the laser after they watch my surgeries. Look at that tear right there in the posterior longitudinal ligament, the PLL, right there. That's a tear in the PLL. So that's beyond the disc. That is past the annulus. This is the annulus right here I'm working on. And you can see the PLL, posterior longitudinal ligament, also has a tear. And that tear right there is where all that dye leaked out around the nerves. The nerves and spinal cord are just below that. But wow, what a view. Look at this view. The spine surgeons that do ACDF and artificial disc, they don't have this good of a view. This is a much better view than they have. As a matter of fact, I can see the laser vaporizing tissue that is 0.05 millimeter, 1/20th, there's another herniation, 1/20th of a millimeter thick. So with the laser and the endoscope, I can remove pathological tissues that are 1/20th of a millimeter. There is no other surgery in the world that's as precise as that. Laser endoscopic surgery is the most precise surgery. There's no linear accelerator, gamma knife, radiosurgery, endovascular surgery that comes close. Endoscopic surgery is the most precise surgery that we can do on the spine. Everything else is less visible. But of course, neurosurgeons that don't know how to do this surgery, they're going to tell you this is bad surgery, it's dangerous, you got to watch out for it. They make things up. They make things up because they don't know anything about the surgery, but they make things up that are believable, right? We all saw Star Wars. So what they'll tell you is, oh, you should not have laser surgery because, you know, you saw Star Wars, right? They had laser guns in Star Wars. They shot people with them and they killed them. So people get this image that lasers are dangerous, but lasers are used all the time in medicine. And more importantly, this is FDA approved. Our federal government has reviewed this laser and this laser fiber and has approved it. They've approved it not just to be used in medicine, but to be specifically used in the spine. This is FDA approved for the spine, and not just the spine. This is FDA approved for the disc in the spine, and that's what we're operating on. We're operating on the back of the disc called the annular tear. So we are using FDA approved equipment that has been determined to be safe and effective for patients. And we've published the results of this surgery multiple times over the years. I've even taught it at the American Association of Neurological Surgeon meeting, at the Congress of Neurological Surgeon meeting, at the Florida Neurosurgical Society meeting, and at the Southern Neurosurgical Society meeting. They've invited me to come and speak and present our data after being peer-reviewed. So, this is a peer-reviewed and previously published surgery with great results. And if you're considering having a cervical fusion, ACDF fusion, artificial disc, don't. That's old technology, it's dangerous. They have high complication rates and patients end up still being in pain afterwards. And they have to go to pain management quite often, okay? So I would avoid those invasive surgeries. You don't need them anymore. We don't need to put cages in your spine anymore. We don't need to put metal discs in there to replace degenerated discs, okay? Now there's still a need for fusion, for example, in trauma or tumor or deformity or infection, right? But those are rare causes, rare surgeries. They're not that common. But degenerative conditions that cause neck pain, the best treatment is the Duke laser disc repair when the pain comes from a disc. Now you guys saw our video, 30 different things cause neck pain, right? And of those 30 things, there are the discs in the neck, which there are how many discs, Henry? You've got C23, C34, C45, C56, C67, C7T1. All right? Now, of those 6 discs, only like 3 of them cause the neck pain in 99% of patients. Okay? We never see a C2-3 herniation causing neck pain. It is so rare. You might see it 1 in 10,000 patients. That's how rare it is. And the most common is C5-6. Look at these giant tears in the back of the posterior ligament. One there, and we saw one earlier over here. These are big tears from trauma, and inflammation has been leaking out around her spinal cord, causing all kinds of effects on the nerve and spinal cord. Okay, this is a bone spur right here. So they say, oh, lasers can't remove bone spurs. Well, what are we doing right now? There goes the bone spur. Say goodbye, bone spur. It's literally gone, vaporized in seconds. Now, if you had open neck surgery, the surgeon would be pulling out a drill or a scraper, and they would not be able to see what we're doing right now. They wouldn't see that level of detail, because using a microscope or using loops, which is what most spine surgeons do. They don't know how to use microscopes, a lot of them. Orthopedic surgeons aren't really trained to use microscopes in their training. At least my day they weren't. Maybe they are now. But orthopedics will use loops. A lot of neurosurgeons use loops. These are little like glasses they put on their eyes. They can't see this detail back here. So they're down there scraping away at things that they can't see. Do you really want a spine surgeon scraping away at bone spurs sitting on top of your spinal cord and nerves when they can't even see what they're doing? They're just kind of going down there and guessing. Hell no. But that's what a lot of these surgeons do. Okay? Why do they do it? Because that's how they were trained to do it, and that training hasn't changed in years. Here's a herniation right there. Look how scarred up it is, sitting right on top of her spinal cord. Okay? Any questions?
Yes, we have a few questions. This first one is coming from Scott, once more on YouTube,
Sure. Hi, Scott.
saying how long is a standard recovery time for this procedure?
1 hour, Scott. 1 hour is the recovery time. You can literally go back to work the next day. You can drive the next day. You can go back to work the next day. You just can't lift heavy things. If you're a professional football player, I'm not sending you back to full contact the next day. So you're going to take some time off. But most people aren't professional football players, right? Most of us have desk jobs or, whatever, construction. And those kind of people can go back to light duty the next day. You can go back to, riding a bike the next day. You can go back to a lot of things the very next day. People ask me about golf. You can start putting the next day. I don't want you playing the fairways or driving the next day, but driving the ball, you got to wait 6 weeks for that. But the recovery from this surgery is the fastest of all surgeries for the spine. There's no surgery that's faster. All right, just about done with this disc. Great. So far, she's doing phenomenal. How is she doing from an anesthesia standpoint, Dr. Bernda? She's doing perfect, he said. Great to hear. All right, now I'm going to take some more questions in a moment, but before I do, I'm going to give you a chance to type them up. And while we're doing that, Henry's going to show you another video we made on how it is that a herniated disc could be the #1 cause of neck pain.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Okay, great. So before I talk about that video you just watched, look at this herniation right here. Another herniation. I can't get it out because it's too big. So I'm going to go in and grab it and pull it right on out. And it should come out. Let's see. It's probably around 5 millimeters again. Now, there it is. Look at that, guys. A little bit of blood around it, but there it is. You guys see this? Look at that. That's
Yes, we
so
do.
cool. All right, there it is, and it's 5 millimeters, just as I told you. Now, compared to the last one, this one's harder. It's a little firmer, so it's more scarred up, okay? But that's what a herniation is. It's not one piece that comes out. It's a lot of pieces that herniate over years. And every time they herniate, you get a flare-up of neck pain. We're just about done with this disc. And I want to show the audience, now that you guys have seen how it is that a damaged disc will cause neck pain, let's show them how we fix it with the laser.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4 millimeter skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We are now finished with C67 disc repair with the laser. We're going to move up to the next disc, number 5-6. To do that, I need to bring the x-ray machine in so I can use fluoroscopic guidance and get to that next disc. In the meantime, Henry's going to ask me some more of your questions.
This next question is coming from Lanu on YouTube,
Hi, Lanu. Welcome back.
asking, I have seen many patients that have back pain, but they also have arthritis. Based on your observation, do you see this a lot?
Yes. The number one cause of back pain is arthritis. But the question is, where is the arthritis located? And the answer is the disc, 85% of the time, the facet joints, 10% of the time, and the SI joint, probably around 3 to 4% of the time. The point is, it is arthritis, you're right, but it's arthritis of these joints, the disc, the facet, the SI, that account for about 95% of chronic back pain, okay? And that's what we're fixing with the laser surgery. This is arthritis of the spine right here that we're working on right now. It's in the disc. Arthritis happens within joints. The disc is a joint. All right, shot. We're going to move up to number 5-6. And to do that, I've got to come out with the dilator to the front of the disc and then get onto the anterior longitudinal ligament, which I'm on right now. And then I got to slide up to the next disc and go in. Any other questions?
Yes. This next question is
Scott?
coming from Faisal on Facebook,
Oh, Faisal. When are we going to see you here, Faisal?
saying, Hi, doctor. Hope you're well.
Thanks.
How,
You too.
how big does a disc herniation in the C-spine need to be to cause symptoms?
The herniation can be very small. Most herniations that cause symptoms in the cervical spine or lumbar spine or thoracic spine are the same. They're small, very, very small. Most radiologists will call them bulges. 1 millimeter, 2 millimeter, 3 millimeter bulges are probably the most common cause. All right, looks good. Shot. So I was right in the dead center, which I want to be, as I enter the front of this disc. Let's get another AP just to make 100% sure we didn't slip off to the side. You don't want to slip off to the side of the disc. You'll end up in the carotid artery, jugular vein, esophagus, trachea. Very bad things, okay? Hold on. Let's just stay there. Stay there. I just want to reorient the dilator. Shot? All right, really good. So we're inside the front of the disc. We're in about 5 millimeters, and you can see the spinous processes right in the midline. So we're in good position. I'm happy with that. All right. We're going to go to the back of this disc, just like we did on the other one. And we're going to basically deal with the herniation and annular tear in the back of the disc. This is not a discectomy. This is not a fusion. This is not a laminectomy. This is not an interspinous device or stimulator. All those surgeries are far worse for the patient, better for the surgeon. Shot. Those surgeries pay the surgeon a lot more money than I get paid doing endoscopic laser surgery. And in the United States of America, those surgeries are generally covered by the insurance. Insurance wants to cover surgeries that don't work because, let's face it, if the surgeries they covered work, there's the tear, then everybody would want them. And then they would have to pay for more surgeries, and their profit margins would go down. So from a business standpoint, insurance companies deny treatments. In the United States, they denied 850 million medical procedures last year. That was reported by the Wall Street Journal, not me, but the Wall Street Journal. 850 million denials. That means the insurance said, no, we're not paying for that to doctors and hospitals and providers last year. So, denying treatment is nothing new for insurance companies. It's how they make money, by saying no. We don't want to pay for that cancer treatment. Just die. We don't want to pay for that medicine that can save your life. Just die. We don't want to pay for that medicine that will minimize your suffering. Just die. That's what the insurance companies have been saying for years. People don't know about it. People need to know about it. And that's why we're telling you about it. The truth is, the insurance companies are not your friend. They do not want to cover what's best for you. They don't want to pay for anything, to be honest. They just want to take your money and give you nothing in return. That is how they make the most profit. All right, any other questions?
Yes, this next question is coming from Raul on YouTube.
Before we take Raul's question, just want to show everybody
Turn on.
what endoscopic surgery is all about. Look at this incision. That's a 4 millimeter incision. You guys see that? 4 millimeters.
Yes, we do.
And we're going right through the front of the neck. We're not doing any damage internally. The dilator that was put in spreads tissues apart. When we come out, the tissues are going to come back together. Nothing is cut. Nothing is damaged. There's no bleeding. There's no narcotic painkillers after the surgery. There's no hospital. This patient goes home. As a matter of fact, she's going home an hour after her surgery. I talked to her and her husband. This is an amazing surgery. 0 complications, surgical complications in 19 years, immediate recovery in 1 hour. And the success rate at curing pain is 99.6% of disc pain is cured. So you can't do better than this, folks. What those surgeons are offering you, fusions, artificial disc replacement, discectomy, they are very bad surgeries compared to this. That's why we're broadcasting, so everyone can learn the truth. The truth is, the medical device companies have a stranglehold on the practice of spine surgery, and they're promoting their devices and treatments that make them billions of dollars a year. Billions. That's billions of dollars a year from your insurance. And those treatments don't cure pain like ours does. So why would you ever want to have a spinal cord stimulator? It doesn't cure your pain. Why would you ever want to have a laminectomy? It doesn't cure your pain. Why would you ever want to have a fusion? It's not going to cure your pain. Go to your surgeon and ask them, if they offered you a fusion or laminectomy, will you cure my back pain? Will you cure my neck pain? And if they don't say 100% yes, we're going to cure it, then you shouldn't be getting that surgery, in my opinion. Okay? Now, there are some exceptions. Obviously, if you have a tumor, you need the surgery to get the tumor out or treat the tumor. If you have an infection, same thing. You don't say no to an infection. You don't say no to a tumor surgery. And you don't say no, in my opinion, to trauma, with fracture dislocation, ligamentous fracture or bony fracture and instability. Those are surgeries that you need stabilization like fusion for, but all the other stuff, the degenerate disc disease, the spondylosis, spondylolisthesis, stenosis, the most common problems do not need those invasive surgeries. That's why we stream, because people need to know the truth. You guys are being lied to and misled by your doctors, and they're recommending treatments you shouldn't be having. Look at that, there's the annular tear right there. Any other questions?
Yes, we have a question coming from Raul on YouTube
Yep, Raul, go ahead.
saying, Dear sir, I am from India. I have cervical pain and I notice that the pain increases whenever I ride a bike. Could you please explain why this happens?
Well, I don't know why it happens, Raul. It's a great question. Maybe it's you have, if you have your girlfriend sitting on the back of your neck. It's a joke. But in all seriousness, neck pain comes from the facet joints and the disc. Now in India, there's another common cause of neck pain. It's called Pott's disease, P-O-T-T-S. And that's basically tuberculosis of the spine. So an infection from tuberculosis affecting your spine. My advice to you, if you want to get answers, what's causing your pain, is to, number one, get an MRI. Number two, submit your MRI to our free MRI review, and then I'll meet with you and I'll do an examination and I'll tell you exactly why you're having neck pain. Okay? But other than that, it's just guessing. Okay? Just guessing. So the most common is disc in the world. The second most common is facet. But then there's other causes, especially in India, where you guys have a lot of tuberculosis that goes to the spine. Next question.
Next question coming from Faisal once more on Facebook, asking, Doctor, would you still do a laser surgery even if the pain has spondylolisthesis alongside with a disc herniation? Thank you.
Yes. Spondylolisthesis does not need anything other than laser surgery. Laser surgery is the best treatment for any symptomatic disease in the neck that is due to the disc. And if I've already diagnosed you with disc symptoms, then you should have the laser surgery. You don't need anything else done. Of course, your surgeon will try to tell you he wants to do a fusion or she wants to do a fusion, and they'll try to get you to do the fusion. They'll show you the slippage and they'll tell you laser surgery won't work because they don't do laser surgery. They have no way to make money off of you if you do laser surgery. They don't want to lose that money, so they're going to tell you to go and have a fusion done because you have a spondylolisthesis. But they're lying to you. Huh? Oh, probably 8 minutes left. 8 minutes. You can start waking her up. All right, you can see we are in the foramen here. That's the spinal cord right down there. And I'm not going to get too close to it. There's no reason. I'm just getting all the pressure off, all these pieces of herniation coming out.
We have another question
Sure.
coming from Lanu once more on YouTube,
Hi, Lanu.
asking, just wondering if the second screening took place for the movie Spine Scam.
Yeah, thank you, Lanu. We've had 2 or 3 screenings, and we're ready for distribution. We've been talking to distributors, but unfortunately, the summertime is when all the distributors go on vacation. So, I am going to be releasing Spine Scam ourselves on YouTube and on a bunch of other streaming platforms that are free. We don't want people to have to pay money. So we want people to be able to watch it for free. We're going to announce when we have the movie available. It's going to be in the next 2 weeks, probably. And it'll be on platforms such as, I'll let Henry talk to this, but for sure on YouTube. It will not be on our Duke Spine channel. It will be on a new channel
Yeah.
called Spine Scam, Spine Scam Movie.
Correct.
That's going to be the YouTube channel, Spine Scam Movie. And what we're going to do is, I didn't make the movie to make money from Netflix. So Netflix doesn't want to, they drag their heels thinking that we want big money. The distributors want big money from Netflix. I don't want big money from Netflix. I just want to get the message out. So at this point, we're going to do our own distribution. And if Netflix likes the movie and we have a lot of views, then Netflix will pay us to do the rest of the series where we expose all the other corruption going on in spine and pain management and hospitals and insurance companies. So we're going to do an entire series of exposure scams in America, what's happening and probably other countries too. But we need to first release the pilot and see what kind of interest there is to get these streamers interested in paying for a series, basically. So we're going to be releasing it very soon in the next 2 weeks. It will not be on Netflix probably. It will be on its own YouTube channel and some other platforms. What other platforms are there, Henry, that you talked to Jeff about?
We talked about getting it on, of course, Facebook. We talked
Oh,
about...
there's another herniation. Look at that one. That's a big one. You guys see this?
Yes, we do. But yes, Facebook. We also talked about Twitter. We talked about pretty much those are the main ones that we're going to distribute towards because they, when it comes to commercial and ad-free, those are the best ones and can spread to the widest audience. And yeah, there was one or two more that I'm just kind of blanking on at the moment, but I know that we're going to post it on pretty much everywhere that we can, commercial and ad-free.
Yeah, there's good international streamers, obviously, like YouTube, Facebook. So yeah, we want to do it for free. We don't want people to have to pay. We want to get the word out. I didn't do this movie to make money off of it. I did movie to help people stay safe and get out of pain, That's the whole purpose, is more of a humanitarian reason, not become a rich movie mogul off the movie. So, all right, we got about 2 minutes left. We're almost done here. This is the number 5-6. We've shown our audience 30 causes of neck pain. We've
Yes, we
shown
have.
our audience the how a herniated disc causes neck pain. Correct?
Correct.
All right.
Yep. And yeah, and as of now, we have no current questions, but we do have about 2 comments.
All right, let's hear our comments, and then we're going to be done. Now, we'll be back right after this with a cervical Duke plasma rhizotomy. This is a veteran of war. I know him. He fought in the Korean War, and he's in his 80s? 90s, huh? Almost 100 years old. This next patient is almost 100 years old, and he's a military veteran, and he's having his neck fixed here at Duke Spine. He trusts Duke Spine Institute to fix his neck. That's what we're going to do. He's got facet pain. Thank God he doesn't have any disc problem. So we're going to do the Duke plasma rhizotomy next. But let's go ahead and take any comments we have now. I've got about 30 seconds left on this disc.
This next comment's coming from 12Chico79 on YouTube,
Welcome to our stream, 12 Chico 79.
saying, "It looks like some amazing work, sir. Oh, and Nikki's the best."
Ah, Nikki is the best. Nikki, you got a fan. Woot, woot. All right. We're just about done. You guys can see I got rid of all the herniation. I think there might be just a tiny piece right here. I don't see any more. It's looking damn good. There's a little bit of, like right there, right on top of the spinal cord. Just got to be careful. I don't see putting pressure, but that's scar tissue right here that I'm removing, scar tissue, bone spurs. Yeah, but this is like 1/20th of a millimeter. Remember that fiber is 0.5 millimeter, 0.5. So if that's half a millimeter, you can see how easy it is to do 1/20th of a millimeter, right? with the laser. It's so precise. That's why when you hear doctors saying, oh, laser's dangerous on the spine, they're lying to you. They either they don't know, or they obviously don't do it. They don't know how to do it. Learning how to do this surgery, I had to go outside the United States. And most of these doctors are too lazy to leave their practice like I did and leave their home and go spend time overseas learning a new technique. But I did it because I believed it was better for my patients, and I wanted my patients to get the very best care in America here at Duke Spine. But a lot of doctors just do what, pays the biggest money, which is fusions, artificial discs, and, pain management and laminectomies. That's how they make a lot of money. And so you guys need to be aware of that, and in my opinion, stay away from these doctors that want to do invasive treatments, because they're just after the money, in my opinion. If they wanted to do what's best for you, they would be doing this surgery for you. With the results we have, they would be doing this surgery. All right. Here's the incision. You guys see it?
Yes, we do.
No bleeding. This is all the blood from the whole surgery. It's like 5 drops. So it's not even a full mil. 1 mil is 20 drops. 1 ml is 20 drops. If you did fusion on this lady, she would be losing 50 to 150 mil of blood. All right, we lost like 0.25 mil. We're going to put a Steri-Strip. She's going to go home in an hour. Thanks, everybody. Great job. Henry, why don't we leave our audience with one of our patients who had this surgery?
Of course.
Good morning, I'm Dr. Duke Magin. I'm here with one of my patients from Canada who traveled actually from Toronto to Florida to have Duke laser disc repair to fix 2 herniated discs, one in his neck, one in his lower back. And you had your lower back done last week, and we were actually supposed to do your cervical last week, and we had our air conditioning break, and we got it fixed over the weekend, and you had your neck done yesterday. So you've actually had the Duke laser disc repair done on your neck and your lower back. How's your lower back feeling?
Brand new.
Amazing,
As if it was never injured. I still am in shock. I can't believe that you were able to achieve this result after I've been suffering with this problem for just over 5 years now.
Yeah, since your accident.
Yeah.
Trauma is the cause of herniated discs. You herniated your disc in your lower back. You had pain for 5 years. In Canada, what did they do to treat your pain in your back and your neck?
I started with medications, nerve meds, narcotic painkillers. I was instructed and told to have nerve block injections to help with pain management. I did physio, I did chiro. Finally, I got to a point where I started to do the nerve ablation therapy, and I did 2 rounds of that.
But the pain came back.
And the pain always came back, and I was looking for a repair, a permanent solution, so I can get back to, having some normality of my life. And I found the Duke Spine Institute, sent my MRI over right away. I had my consultation within not even 10 days with Dr. Duke in person, like in Zoom. 3 weeks later, I flew out here and I feel like brand new.
It's amazing,
so thank
isn't it?
you. Yeah,
You're welcome. You're welcome.
This was life-saving for me because I didn't really have a great life before this experience.
And you can tell the pain is gone now.
Yeah, I was having numbing in my legs. There was days where I couldn't even walk. I was completely debilitated, stuck in the house, pain, numb. I thought I was going to be like paralyzed at one point. That's how bad it was.
And how are those symptoms now that you had the procedure?
Gone. I have full feeling back everywhere. Like, it's unbelievable. I can't believe it.
All with the Duke laser disc repair. You could see we went in and we found the actual tear where the herniation came out in the back of the disc, and we used the laser to clean it out, debride it. Now here you are doing fantastic.
Yeah, thank you.
You're welcome.
So much.
Is there anything else you want to tell your fans out there?
I did my neck. I did my lower back. I had the worst symptoms. I came here, an hour each procedure. This is the day after. I had my procedure yesterday at, what time did you take me in? Like after 9 maybe?
Yeah, around 24 hours ago.
And I haven't taken any medication since I was discharged and gone back to the hotel. Not even Tylenol. Like, I feel great. It's
Yeah.
unbelievable. I highly recommend anyone that's suffering like this to just come out and get fixed, because you will definitely have a way better quality of life. Don't suffer.
Yeah, don't suffer.
Don't suffer.
We can fix the back and neck.
There's
pain
a
here.
solution. He's the solution.
Thank you.
This is real. Everything you see on the internet about Dr. Duke is real. Any negative reviews you read about Dr. Duke are none. They're not real. They're just people that are just not happy with themselves, because I read them all on Google and I had to make this decision, and I'm very glad I did, because I believed everyone that was talking about their results, and here I am. So thank you.
Congratulations, my friend.
Thank you.
Enjoy the rest of your life.
Thank you.
Yeah, you're welcome. All right, let's get you out of here.